Welcome to The Backstory with Dr. Ricky Singh. This podcast is focused on bringing you the latest research-based information about dramatically improving health, well-being, and quality of life. And here's your host, Dr. Ricky Singh.
Welcome to The Backstory. And today we're returning to a topic that I love talking about, something around not only what we eat, but also what comes out, and specifically gut health and GI health. You know, there's a saying, you are what you eat, and we're going to find out if that's actually true today by speaking with our expert. My goals are to discuss topics like probiotics, maybe even prebiotics, certainly the gut microbiome, and then obviously what conversation with a GI doc doesn't touch on poop. So we'll touch on what goes in and what comes out. So my guest today is an assistant professor of medicine at Weill Cornell. She is a clinical gastroenterologist with advanced training in nutrition and obesity sciences, and has published multiple review papers and original articles examining diet's role in treating common gastrointestinal diseases. And not only that, but the link between malnutrition and gut pathology. I hope I said all that right. She's the co-director of the iChange program, which we will discuss at the end of the podcast. So without further ado, please welcome Dr. Carolyn Newberry to the Backstory podcast. Dr. Newberry, welcome.
Thank you so much for having me. I'm excited to speak today.
Great. You know, I love that, you're an MD, you're an allopath physician, you specialize in GI health, and yet you still maintain interest in nutrition and obesity and all the stuff that, we don't always learn in medical school. We learn about the drugs and endoscopies and colonoscopies and things like that, but you maintain that interest in the natural ways for healing. So tell me a little bit about you, how you got interested in gastroenterology, and also how you maintain some interest and exposure to nutrition in your work.
Sure. Yeah. So, thank you so much for that introduction. And that was perfect. I think I have been interested in gastrointestinal diseases and becoming a GI doctor since early on in medical school training. And actually what drew me to it was sort of the nutrition link. I thought when I was a medical student that if you were an expert in the digestive tract and its pathology, then you would learn a lot about nutrition and you'd be able to use diet and lifestyle modifications to help people with their gastrointestinal health. And what was interesting is actually when I started medical school and went through my residency and fellowship and all the years of training that we do, I found that we got very little actually training in nutrition, and that surprised me. And so I actually had to seek it out myself and did a separate fellowship through the Nestle Institute, which does nutrition training for physicians, and found that gastroenterologists surprisingly know very little about nutrition. And so I've now made it my personal goal that I'm on faculty here at Cornell to teach our fellows more about nutrition and actually build a nutrition curriculum for them.
It's so interesting. We learn about pharmacology and innovations, and in my world with spine care, injections, epidurals, and pain medications, yet we rarely touch on what's a healthy diet. How do you maintain healthy weight? Exercise protocols. In rehab medicine, we do learn about exercise and physiology, but you're right. The medical training that we went through is very technology and innovative focused and less preventative. So let's talk about that. We were going to talk about it at the end, but let's jump right into iChange. Tell me about this program. What does iChange mean? What does it stand for? Who are some of the providers in this program? And what are the services that we offer here at Weill Cornell?
Yeah, those are great questions, and I'm excited to talk about our program because we're really proud of it. So iChange is a catchy name for the Innovative Center for Health and Nutrition and Gastroenterology, and we really focus on treating gastrointestinal diseases through diet, lifestyle management, and weight management. And so we are a multidisciplinary team. We have a gastroenterologist with specialized new training in nutrition, who is me. We also work with a hepatologist who is interested in fatty liver disease, Dr. Sonal Kumar. We additionally have an endocrinologist on board who helps with a lot of our thyroid disease, other endocrine disorders, et cetera. And her name is Dr. Michelle Young. And then we have a number of wonderful dietitians on staff who work with us and support, our lifestyle modification and our counseling. And finally, we partner with our bariatric surgery colleagues. And we additionally have a gastroenterologist, Dr. Reem Sharaya, who performs endobariatric procedures. So that's and we could talk a little bit more about what that means because it's a lot of medical jargon, but really it's non-invasive options for weight loss.
I love that it's multidisciplinary and comprehensive. I think probably every center here at Weill Cornell could use a dietitian and nutritionist to help, whether it's cardiac health or cancer or what I do at the spine center. So I love being able to partner with you guys and optimizing our patients' function and health and keeping them moving the way they want to. It sounds like a lot of the strategies that you employ when you see patients is to probably prevent a bariatric surgery or prevent needing these big interventions. So kind of tell me, what is that patient experience like when they come see you guys in the center? Is there an algorithm or triage protocol, or how does that all work?
Right. So yes, of course, every plan is definitely individualized. So it depends on what the patient needs. I talk about to patients that, they come in with a specific GI complaint, whether that's heartburn or change in bowel habits or bloating, which are obviously all very common. And then, of course, I can use medications. I'm still an allopathic, trained Western doctor. But, let's also talk about the root cause. And if there are some lifestyle modifications or patients would benefit from weight loss, then we can actually enroll them in a formal program for that. So patients come in, we manage their GI complaints, but we also set them up with a dietitian who do monthly counseling sessions. We talk about exercise regimens. We actually do use medications to help people lose weight if it's appropriate. And yes, if we find that this is a good candidate for something like a bariatric surgery, it's never like the end goal, but it's something that certainly is brought into some people's treatment plans because that is the best option for them.
Let's touch on one of the topics you mentioned, which is nutrition and diet and, what do we put into our body? We know the gut's important. If we couldn't digest food, we couldn't gain weight and we couldn't live. So we know that if you neglect gut health, you're really missing the boat on overall health and wellness. And there's a lot of buzz lately on something called the gut microbiome. Everyone talks about it. Microbiome, optimize it with prebiotics, probiotics, etc. Tell us kind of, without getting into the weeds about the science, what is the gut microbiome? What does that actually mean?
Sure. So I think in its basics term, the gut microbiome is just the bacteria that live in your small intestine. And we know that they're in both the small intestine and the colon. We know in the colon there's millions of bacteria actually, and in the gut there are several thousands. And so it's a large, really rich community in there that actually does keep us healthy. The problem is there's new research that shows that depending on what you eat and lifestyle factors and external environment pressures, I call them, stress, sleep patterns, et cetera, the microbiome can become less healthy, less optimized, and then actually can lead to more chronic diseases.
It's scary to think to some of our listeners that there is bacteria floating around in our gut, whether it's stomach or small or large intestine. And you mentioned some of it's healthy, some of it's not healthy. So how do we know the difference? What kind of presents in our own bodies or in our symptoms when we know something might not be right down there?
Right. And, we're definitely learning a lot more about that. And there's a lot of research and research funding being poured into this question. I mean, from a basic sense, I don't know if we fully know which bacteria you should have in your gut and at what ratios to exactly have, quote, the ideal microbiome. But what we do know is that people who eat high in amount processed foods, high fat loads, high processed sugar loads tend to have what we call more of the bad bacteria, and people that eat more whole foods, less processed foods, whole grains, fruits, vegetables tend to have more of this, quote, good bacteria. And this can manifest in a lot of different gastrointestinal complaints. So people with this, quote, bad bacteria may experience worsening bloating. They may have change in bowel habits. They may have abdominal pain or nausea. And we think there are some new studies that show it may even lead to weight gain. And so, it's a very important topic to talk about and sort of understand more about.
You mentioned some things that we talk about a lot: processed food, good fats, bad fats, and eating fiber, whole food, things like that. Other than the symptoms, you mentioned bloating, changes in bowel habits. Are there other tests that patients can undergo, coming to the clinic and seeing you guys, where you can objectively say, yes, this bacteria in your system is high, it should not be, or this one's low, we should make it higher? What are some things that you can intervene with?
Right. So one of the basic tests we can do is called a breath test. And what it does is we have people eat a certain amount of a sugar load. And there's different types of sugars we can use. And then we actually measure the amount of gas that the person expels over a period of time. There are certain ranges we believe to be normal. And if the gas levels are higher than that, then we call that to be excess bacteria. And so we entitle that small intestinal bacterial overgrowth. And this can sometimes be helpful to understand why someone's having specific symptoms. And some patients benefit from antibiotic courses in that case.
There's a whole world out there of unregulated use of supplements, prebiotics, probiotics. Before we get into that, tell us about the difference between those two categories. What are prebiotics? Admittedly, I was on a probiotic. Someone said, get on this Garden of Life, live microorganism thing, keep it in your fridge. I took it for a couple months. I'm not sure I noticed a difference. Maybe I didn't need it. But what is the difference? Prebiotics and probiotics. And then after that, let's talk about the science. Is it beneficial?
Sure. And this is also a great topic, and I think one of particular interest to people. So prebiotics are the food that probiotics eat. And so prebiotics are actually fibers. So any type of fiber really can serve as a prebiotic. Probiotics are the actual bacteria. And the way that the World Health Organization defines is that they're these living organisms that confer health benefit. And it's mostly bacterial. There are a couple of fungi just to throw in there to confuse things a little bit. So we know that you need, strong prebiotics, so a lot of fiber intake to feed these probiotics. And so there are a lot of thoughts about how we should be taking these and whether they confer true health benefits. But, the data is unclear in a lot of circumstances, and we can certainly talk about more details.
Do you think majority of the people out there, listeners and things like that, would benefit from a probiotic? The prebiotic makes sense, and fiber we're definitely going to touch on. But going back to the probiotic, do you think people out there would benefit, or is it too difficult to ascertain without doing an evaluation?
Yeah. So, I think that probiotics themselves are not harmful. And so there are certain people that certainly may benefit from probiotics. The American Gastroenterological Association, so our main governing board, has written some guidelines in terms of probiotic use and what is actually effective when they do research studies. And they found that people with certain types of history, so those with inflammatory bowel disease that have had certain surgeries, for instance, or those that are hospitalized and taking certain courses of antibiotics, they truly do benefit from probiotics. And the literature shows that. The problem is for the standard person out there, not in the hospital, not with a history of surgery or an inflammatory bowel disease diagnosis, it's unclear whether it helps them or not. And so what I often tell people is I have had many patients who take an over-the-counter probiotic and they improve their gastrointestinal complaints and they feel better. And so because it's very low risk, I think you should try that. But if you're not deriving benefit, it's not like we make the blanket recommendation for everyone to take a probiotic.
I was reading a study before meeting with you to prepare for our talk, of course, and there was a genetic study. A lot of stuff that we talk about in the spine world is genetics. If you have back pain, I ask about your parents and grandparents. Was there a history of spinal disorder? Presumably the same thing would hold true for our gut microbiome. There was a genetic identical twin study that showed one obese twin and one not obese twin, and they looked at the microbiome and it was a little bit different. So there might be an opportunity to, quote, hack that and improve the genetically dysfortunate person in improving their microbiome. So short of probiotics that you mentioned, what are some other strategies that patients that you treat can employ to improve their overall gut health?
Sure. I think it still comes back to what you're eating. And so we definitely recommend a less processed diet. So something that's high in whole grains. So, trying to avoid refined grains as much as possible. Fresh fruits, fresh vegetables, lean proteins. All of these things are going to, we believe, overall improve gut health. In terms of a particular dietary plan to follow, the largest research is in the Mediterranean diet, which kind of employs those principles with, again, less processed foods, limited red meat intake, more lean proteins, the fruits, the vegetables, that sort of thing. So that's really what it sounds basic, but that's really all it is, rather than following the fad diets, just trying to less processed foods as a whole.
I'm great you mentioned Mediterranean. You're probably the fourth or fifth guest on our show that's mentioned that diet. We have Dr. Rekha Kumar from endocrinology, obesity management, and a bunch of others saying the same thing. Don't follow the fads. Follow things that work. And the Mediterranean diet, which consists of whole foods and plants and legumes and things like that, tends to be the most favorable if remaining consistent with that. Another supplement that comes up a lot, and I'm talking about supplements because this is what patients ask me, and people out there talk about supplements. It's a $49 billion industry in the United States. That's billion with a B. So I want to make sure, is it necessary and are the patients getting the right things? So another thing that comes up is magnesium. And, magnesium is no stranger to us in medical training. It's on the crash carts. You give it to pregnant women when they come in for labor. You help patients getting a colonoscopy, give them magnesium, whether it's in mag citrate or something like that. How does magnesium play a role in overall gut health? And do patients need a supplement that presumably if they're getting a good diet, they don't need to, but tell us a little bit about magnesium.
Sure. I think it's a good question. I think supplements in general are very challenging, because they're not FDA regulated and we don't necessarily know what's in them. But I do believe that they do benefit some people. So I'm certainly not anti-supplements. In terms of magnesium specifically, and as you mentioned, if you're eating a balanced diet, you don't really need to supplement a particular micronutrient like magnesium. Magnesium can be a gentle laxative though. So if you're constipated, something is sometimes we reach for, either as magnesium citrate or magnesium oxide. And so no, I don't believe if you have a healthy diet, you need to be on a magnesium supplement, but we may choose to use it to help with certain digestive complaints, particularly constipation.
One of the things you mentioned earlier was fiber. Now, fiber comes in various forms, whether it's soluble or insoluble, and there's so many brands out there, FiberCon, Metamucil. Can you speak a little bit about fiber and how you employ it in your practice and when one patient would benefit from it or not?
Sure. So we love fiber. And I think I probably prescribe fiber more than any prescription drug that's out there. So as you mentioned, there's a lot of different types of fiber out on the market. There's both soluble types. Those are the stuff that dissolve in water. And the way I explain it to patients, if you throw it in a bucket of water and it spreads out, that would be a soluble fiber, something like plain oatmeal. And insoluble fiber in the food form is, raw leafy greens, raw veggies, piece of celery. You throw it in a bucket of water, it doesn't spread out. It kind of has more of that fibrous tissue. Both of them are very important for digestive health. Soluble fiber in particular can be beneficial in patients that experience a lot of bloating and altered bowel habits, both constipation and diarrhea. So if you have altered bowel habits that go both ways, it's a really nice tool to use. In terms of getting it in diet versus through a supplement, of course, diet is always absolutely ideal, but it isn't always realistic for people to get as much fiber as they need in diet. And so using a supplement is certainly reasonable. There's a lot of different brands on the market. And what I would say, it just depends on what your specific complaints are. So always work with your physician or your gastroenterologist to understand which fiber would be right for you. I tend to like soluble fibers, like in the Metamucil or Citrasil categories, because they are, jack of all trades that can really help with different types of digestive complaints. And if people are particularly sensitive, because those sometimes are flavored and sometimes have sweeteners in them, there's also a number of unsweetened options that you can buy on Amazon that we could talk in more detail about if anyone had particular questions.
I was reading about the typical American diet, or it's called the standard American diet, right? SAD, and how much fiber we typically get. In American diets, we usually get between 8 and 15 grams. And when we compare that to our ancestors from 1,000 years ago, the hunter-gatherers, they used to get 100 grams. And what I've read is that they suffered a lot less from digestive issues the way we do. Is there a minimum gram of fibers that you recommend patients get? And if they're not getting it in their diet, they should go to a supplement?
Yeah. So in terms of the recommended daily allowance that the government sets, we actually are saying about 25 to 30 grams per day. So yes, the average, about 95% of Americans, I think the current stats are, do not achieve that amount of fiber intake. So any way you can try to sneak fiber into your diet is great. I always tell patients you can grind up some chia seeds or flax seeds, put it in some oatmeal in the morning, put it in a smoothie that you're having or a soup or something, trying to do baked goods with whole grains. And again, adding, lentils is a little extra. There's lots of different ways you can sneak fiber into your diet, but you have to think about it because the average American diet just doesn't have it.
Yeah, you mentioned lentils. I'm a big believer in lentils. We're Indian and a lot of our foods are dal rich and lentil rich, but sometimes with too many lentils like kidney beans and things like that, I suffer from gas, from bloating. Tell me what is happening in my body where when my mom or my mother-in-law comes in and brings lentils, immediately my reaction is, I cannot eat this because I'm going to suffer for a couple of days. So what's happening in the body with gas and bloating?
Right. So yeah, absolutely. There are some people that can just eat lentils all day and they won't have any digestive complaints. And there's other people, it's certainly one of our pro-bloating foods. And so you may have to find an alternative fiber source if that's you. Sometimes it's just the way that the body processes it, and it may have to do with the microbiome. And so, you eat these fiber sources and they're prebiotics. And so the bacteria in the gut ferment these products and they actually produce extra gas, which can cause a bloat. And it can also change the way you absorb things. And so you can get a little bit of diarrhea. And so if you are somebody that is sensitive to that, then I say, trying to eat things in smaller portions, the lentils in a smaller portion rather than trying to have a big bowl. Or again, trying to find an alternative source of soluble fiber. And there's lots of different options out there.
Am I doing harm to my body by eating lentils, even though I know I'm going to be, again, a little more gassy or bloaty? Should I add a probiotic to combat those symptoms?
Yeah, it's a good question. You're certainly not doing any harm. I mean, whenever we talk about food sensitivities that culminate in things like bloating, it's not dangerous to eat any of these foods. If you're lactose intolerant, all that means is that you have less lactase, so that enzyme that breaks down the dairy sugar. And so if you overwhelm your system, that mismatch between the lactase and the lactose dairy sugar just doesn't work so well. And so no, you're not hurting yourself in any way, and it's still healthy to eat the lentils, but you just may not feel well. And so that's where, seeing your friendly gastroenterologist can be helpful, because you can actually develop, a more comprehensive dietary plan. And we work very closely with our dietitians as well to help us do that.
I wasn't going to talk about this initially, but you mentioned dairy products and lactose. Are humans lactose intolerant? Growing up, I could drink gallons of milk at a time. And now, I have milk in the house because of my kids. And every once in a while, I crave a bowl of cereal. And the next day, I am paying for it because I guess my body doesn't want dairy in my system anymore. Are humans built to be lactose intolerant, or is it just individualized?
Yeah, so it's definitely individualized. I mean, definitely over time, we believe there's been changes in the lactase enzyme activity. And there are certain ethnic backgrounds that do tend to have more lactase deficiency than others. We also find that people lose lactase enzyme activity as they get older. So there may be people, as you mentioned, that could eat, gallons of ice cream or drink a lot of milk when they were kids, and they don't feel so well when they do it now. And it's all about the mismatch. So you just have to find, patients get frustrated because they want to just take a test, and you tell them, you can eat this many grams of lactose per day. But it's really usually more of an elimination diet and figuring out what you can actually tolerate.
Yeah, I think you're right. It's a learning process. And I have changed my diet throughout the years, chili and stuff like that, no problem 10 years ago. Now I love making it. I just can't eat it because I know my body's not going to tolerate it well. We've spent some time talking about intake. Prebiotics, probiotics, fiber, magnesium supplements, obviously the Mediterranean diet, whole food, plant-based. Let's talk a little bit about the other end of the GI system, which is what comes out and stool. And if you answer this question, what is normal stool? Is there a normal consistency of stool? And when should someone be alarmed of, hey, I might need to get this checked out?
Yeah, I mean, that's another great question that we often get asked. There's a broad range of normal stool patterns. And what I always tell people is that you should feel full evacuation of stool at a level that's comfortable for you. And so I keep it very, very broad, because there are some people that need to go to the bathroom 3 times a day to feel fully evacuated and feel like they've eliminated everything they need to. And there's some people that'll go every 3 days, and it's still perfectly healthy. As long as you're not having symptoms in between the bowel movements, you don't feel bloated or nauseous or that you have to evacuate something, it's fine. The stools that come out, ideally they're formed, so not particularly watery or loose and not hard to pass or pellet-like. The color, the average color of stool is brown, but any color that's not red, white, or black, we don't worry about. So people will come in, oh, my stool is purple or orange or green or whatever it is, and that's all fine. We tell you not to worry about it at all, because it often has to do with what you're eating and what your microbiome looks like. And really the only colors we worry about are those that indicate blood. So the red or the black or white can indicate a problem with the liver. So you should see a doctor if you see those colors.
Short of my 5-year-old daughter, who does share what her stool looks like on a daily basis, I'm sure not a lot of listeners out there have people come into the bathroom and say, look at my stool, what do you think? So I'm glad you mentioned that it's normal, or it could be normal, to have a bowel movement every 3 days, if that's the normal you. And even in those situations, do the same rules apply regarding the consistency, the color, and the texture, even though it's so infrequent?
Yeah, I mean, people that go to the bathroom less frequently may have a higher volume of stool when they go, because that's just how their body functions and how it digests foods and processes it. I would say certainly the color is still the same, and the consistency as well. I mean, you should be able to pass stool where it's not uncomfortable. You're not having pain when you're passing stool. You're not having little pellets come out that you're straining to go. And it also shouldn't be super watery, ideally. Now, certainly there's a lot of people that have irritable bowel syndrome, which really is just a brain-gut dysfunction where you may have looser stools than the average person. And there may not be anything pathologically wrong, but certainly if you're noticing loose stools, you should see a doctor just to confirm that.
Let's talk about those two spectrums, when it's the dry, pellety, and loose-ish. When someone out there sees that their stool falls into one of those two categories, what are some of the strategies that they can just change in their own lifestyle to help bring that back to, quote, a normal-looking stool?
Right. I mean, I still think, if you notice a particularly an acute change in your bowel habits, you probably should at least talk to your primary care doctor first and potentially see a gastroenterologist. But if you know that you've had a lot of, I call them again, environmental triggers. So whether that's changes in your eating patterns or your sleep cycles or your stress or anxiety levels, et cetera, it's trying to understand what those triggers are that are changing the bowel habits. And so, in terms of diet, we want to try to stick to that Mediterranean, whole food, high fiber diet if possible. That can certainly improve bowel habits. Exercise certainly can improve bowel habits. This is probably surprising to nobody. Better sleep patterns, dealing with stress. They've done these interesting studies that actually show in patients that have irritable bowel syndrome, sometimes mindfulness techniques, things like acupuncture and yoga and everything can be just as effective as us giving them prescription medications. And so certainly you can try those things on your own, but do make sure if there are changes that you are talking to a doctor about them so they can at least do some basic lab work and just make sure there's nothing else to worry about.
I love how you speak to mindfulness and other kind of non-allopathic, I want to say, strategies for gut health. So if you're out there listening, we do have friendly gastroenterologists here who aren't just trying to scope you upper and lower on your first visit. Talk specifically about how you discuss stress, anxiety, sleep, and some of these external lifestyle modifications that can help a patient's GI movements. How does that actually go on in your practice?
Sure. So, if somebody came in for an initial evaluation and told me that they had new digestive complaints or change in their bowel habits, we would go through a series of questions like any doctor would to sort of understand what the other associated symptoms are. And we look for things that we call alarm features. So that would be if you notice blood in your stool at all. So one of those colors that I mentioned that we would be worried about. If somebody is losing weight unexpectedly, so you're not trying to lose weight, but you're losing it, which means maybe there's a problem with the actual absorption or digestion of the food. If someone's having particularly bad abdominal pain, with eating, we may worry about needing to get further testing to understand why. Or if somebody isn't able to keep food down, they're having a lot of vomiting episodes. And then the last would be if things are getting stuck somewhere. So if you feel like something's getting stuck in your throat or something's getting stuck further down in the digestive tract and you're not able to have a bowel movement at all, obviously those are all concerns. If you don't say yes to any of those questions and you don't, depending on what your other medical history is, of course, I'll put that caveat out there. Oftentimes I will try lifestyle modifications and over-the-counter options first. And one of the key components of that is, stress modulation, talking about mindfulness practices, trying to understand if we make changes that aren't medication related, if we can actually improve gut health. And so, I often will work, we have an integrative health center here at Cornell, which is wonderful. So I may refer out to that. There also are certain things that people can do on their own. Maybe they're already working with a therapist. Maybe they already have an acupuncturist that they go to. And so, we can work with those people to try to help with their treatment plans.
It's unbelievable how integral the GI system is with all the other parts of our body and how you can impact GI health through these other disciplines like acupuncture, exercise, physical therapy, mindfulness, meditation, yoga, all the things that we talk a lot about through health and wellness and lifestyle management. But I really appreciate what you're saying regarding optimizing lifestyle, optimizing your diet and nutrition to restore this gut microbiome, which can help you absorb the things you need to absorb and help you get rid of the things you don't want to get rid of. I was reading a stat the other day, and I want you to comment on that. Back to our ancestors, these hunter-gatherers who used to eat 12 to 15 pounds a day worth of food, of which the majority was fiber, like I mentioned, almost 20x what we currently eat, they wouldn't gain any weight. And if, people hear, they're eating 10, 20 pounds of food, that sounds like a lot. Lastly, comment how important this fiber concept is in maintaining a healthy gut microbiome and healthy weight, cholesterol, all that stuff in general.
Right. Fiber, I think, is very important to overall digestive health. It's preventative against cancers. It helps you keep and maintain a healthy weight, partially because it makes you feel full longer so that you're not eating as much. It feeds that microbiome and keeps that, what we think anyway, is good gut bacteria in the small intestine to reduce gastrointestinal symptoms. And so, yes, oftentimes, I'm crazy. I have 2 small children. I'm always throwing fiber into the foods that they're eating. And I think it's important for your body to get used to it because I do believe there's upregulation and downregulation of certain enzymes. And, if you're not eating something, your body tends to not tolerate it as well. So yes, if you have a very low fiber diet and all of a sudden you try to eat 100 grams of fiber per day, you're probably not going to feel well. And it's that slow up titration and understanding your own body and to get to the point that you need to be.
I appreciate that. Dr. Newberry, thank you so much for sharing your expertise on gut health with us. I learned a lot. I learned a lot from all these podcasts. I get to spend time with the experts. I'm sure my listeners can take a few tidbits from what we discussed today. And thank you out there to the listeners for tuning into the Backstory podcast. Remember, according to today, you are what you eat. And when it comes to your health, when it comes to your wellness, we have your back here at the Backstory. Thanks to Dr. Newberry, and thank you out there to the listeners.
Thanks for listening to The Backstory. Please subscribe, rate the podcast, and review The Backstory on Apple Podcast, Spotify, and Google Play Music. And feel free to share this podcast on social media or even your own website or blog. This podcast is for general information purposes only. It does not constitute the practice of medicine, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information is at the user's own risk. The content of this podcast is not intended to be a substitute for medical advice. To learn more about Dr. Singh and his clinical research, please follow him on social media. You can also sign up for his newsletter by going to www.rickysinghmd.com. That's RICKYSINGHMD.com.